Hello, hello, people of Earth. I'd rather be out finalizing things on the trike right now, but I got chased inside due to what the TV commercial says about moderate to severe allergy symptoms, let's call it, right? Kimberly T. Rails has been hanging out today heavily, let's say. And sorry about the noise, that's air filter going, because it is sprayed out, way out, spray out outside. So I'm kind of trapped in the house. Thought I'd research some things. And, my mom has lymphoma and she's doing chemo currently. So I'm looking into lymphoma and the lymphatic system, and I discovered that a lot of the Morgellons issues that I've had over the last 10 years, which seem like they morph from week to week and month to month, as if I've had every disorder there is a name for at some point in time. I'm finding a lot of connections with the lymphatic system, like the phantom touch in the areas where I have nondescript pain or issues with skin texture and hair or rashes of different kinds. It seems to be where lymph nodes are, and I didn't realize, I knew these veins that would bulge out quite often, and then they go away and then they come back. I knew that wasn't right, and it couldn't be my normal veins. But for some reason, nobody I talked to about it seemed to know they were lymphatic, and I've just kind of put that together. I'm like, okay, so that's why they don't look and behave like blood vessel veins. They aren't. They're lymph veins, or detoxing. So I started thinking, well, then a lot of the Morgellons issues that I have had, maybe other people too, have something to do with the lymphatic system, which is a very important system for detoxing your body. And it seems like it's a potential place for things to get built up in, like toxins or parasitic things to live in, especially if the toxins build up there and suppress the immune system. Then that would lead to an easier time for invading parasites to, say, hang out and live there. So I'm just going to call fair use on this video for studying and comment purposes on the subject of Morgellons and or lymphoma. In this guy's video, I picked it because it was just straight to the point, and it's not AI. At least I don't think it's AI. He could be AI. Hard to say. Come on.
He actually didn't have any symptoms, at least not that he was aware of. The way that it was discovered was actually during a routine physical exam by the medical staff of the New Orleans Saints. But this video is not so much about Foster Moreau as much as it is about a patient I had and the warning signs of lymphoma that were ignored. Let's face it, it's easy to brush off symptoms that seem relatively unconcerning. I can't tell you how many times I've seen men who come to the hospital only because their wife bathed with them.
I was Googling, YouTube searched even itching lymph veins, and you come up with videos on lymphoma. Because I get the little itches, and the itches that are associated with Morgellons, like, oh, there's bugs under my skin. Well, guess what? It's pretty much along lymph veins, and they're kind of bulging out right now. As they've been doing it a lot lately. It comes and goes. Sometimes it'll be a lump here, but not here, but here, and they're all pillowy soft, so it's not regular blood vessels. Anyway, yeah, the Morgellons itches and things of that nature, sometimes with poking sensations, they just happen to be where all the lymph nodes are concentrated.
But yeah, it can be easy to brush off the red flag symptoms, let alone the less concerning ones. Now my patient, let's call him Bob, who I first met at 3 in the morning when he was being wheeled into the intensive care unit because he was minutes, if not seconds, away from dying. Well, he was in his mid-20s, and you can imagine what his parents were thinking at the time, and his girlfriend Of course, all very
Wondering what drugs did he take?
concerned and wondering, how did he go from being
Oh,
seemingly healthy just a couple months ago to this? Lymphoma is a type of cancer that starts in white blood cells of the immune system, specifically the lymphocytes located.
So yeah, I've had a lot of issues around my neck and collarbone with the fine fibrous filament hairs, and I discovered that they're highly flammable, and actually, vaporizing them brings relief to the headache and some of the other types of symptoms that are painful and troubling associated with them. Strange as that may seem, I don't deny the results of that, so it's a real thing to me, and it's not I really doubt that it's a psychological, oh, I think this helps me, therefore I feel better, because it fills the room with vaporous, strange odors of vapor, let's say, and it's pretty obvious that whatever's making those smells and vaporizing really doesn't need to be on a person. What's it doing in my skin anyway? It's not burning hair. It's crap in the skin, like fibers. You can't really see them for the most part. They're so fine, nanoscale fine, such as the Kimberly T. Rails nano fiber. Anyway, so we got glands, auxiliary lymph nodes, thoracic duct. Yeah, and that's on the left, the spleen. And this is concentrated on the left side too. I thought it would be near my heart, and it may be, but it's right up in that area with the Morgellons pain center or whatever, where it seems to be concentrated the most. Anyway, okay, let's keep going.
Throughout the body's lymphatic system. There's two main types of lymphoma. 10% of cases are Hodgkin's lymphoma, and the rest being non-Hodgkin's lymphoma. The exact causes of lymphoma are not well understood, but some risk factors have been identified, such as a compromised immune system, certain infections, for example, Epstein-Barr virus, that causes mono, and then also a family history of lymphoma, and exposure to specific chemical.
Lymphoma risk factors. Compromised immune system. Well, why would the immune system be compromised? Well, there's lots of reasons that the immune system could be compromised, right? The compromised immune system, I stopped it right here because we get to the first one and the last one. Exposure to certain chemicals or radiation. Maybe such as, I'm just speculating the possibility of, the known toxic chemicals of aluminum oxide, barium oxide, strontium oxide, all of them with an oxygen molecule attached. So if you were to breathe in these things, your lungs are going to think it's oxygen and accept it in easier. In which case it'll get, right into the bloodstream right away. Just a thought. Could that be, some of the toxic chemicals, that could be some of the certain chemicals, and then the radiation factor. Well, we're immersed in radiation all the time now. It's said to be non-ionizing radiation, meaning it doesn't break down the atomic structure of an atom or some such thing. Personally, it's my belief that there is no such thing as non-ionizing radiation. And when you think about it logically, using some common sense, sure, higher frequencies do not travel as far, therefore they have less impact. However, they impact more frequently. It doesn't, you just look at a jackhammer breaking apart a piece of concrete. One tap from the jackhammer is not going to break the concrete, but 500 of them is going to break the concrete. That's how frequency could work, with things such as Wi-Fi and cell phones, and all of those things, remote door openers, Bluetooth, people stick their Bluetooth thing right in their ears, right up next to your brain. Here, let's just send out this Bluetooth signal that's, could be picked up 50 feet away. Put it right up to your head. That seems brilliant. But could that be the type of radiation that, combined with certain chemicals that may or may not be in the air, could those chemicals compromise the immune system, which could lead to a family history of just speculating? These are things that inquiring minds want to know. I want to know. Let's keep going.
Hodgkin's lymphoma is most common among young adults aged 20 to 34 and is slightly more likely to occur in men. Bob did not have any known risk factors. He was healthy, worked out a lot, but then he starts feeling more tired than usual. He thought nothing of it at first. And then a week later, he has a little bit of a fever, and his girlfriend got into weird that his pillow and the bed sheets were soaking wet. So now his girlfriend drags him to the urgent care clinic. He stands on the scale, and thought it was a little odd that he's now weighing 180 pounds, because the last time he weighed himself, a couple months prior, he was 190. The doctor comes in the room, notices some swollen lymph nodes in the neck, and he's examining it. Chalks it up to
most likely
not every patient with lymphoma is going to develop warning signs, but persistent tiredness and lack of energy, even with adequate sleep, is definitely a common symptom with lymphoma. There's a million reasons why someone could have fatigue, but it becomes especially concerning when it's a new symptom and when it's accompanied.
People don't believe you when you say that, I'm just feel fatigued more than normal. People are just like, you're being a wuss. Don't be a pussy.
Other symptoms. Fatigue in lymphoma patients is often due to anemia.
Went through that with the Morgellons too. I get a cut, a scratch, something, and it just did not heal. Didn't continue to bleed. It seem to scab up quick, but it would not heal. It just stay that way, slightly infected.
Resulted from the cancer cells crowding out the healthy red blood cells in the bone. Unexplained persistent fever can also be a sign of lymphoma. Fever in lymphoma patients is usually due to the immune system's reaction to the cancer cells and the subsequent release of certain molecules of blood cells, like interleukins.
I didn't know there was a
woman often offering to bedclothes or bedsheets.
Okay, anyway, carry on.
It's very common with many types of infections.
Baby, I love you.
It's also really common symptoms of lymphoma.
Please let me
These
go.
sweats can result in the body ramping up the immune response to the cancer. Rapid, unexplained weight loss of 10% or more of your body weight in 6 months can be a sign of many things, including cancer and, of course, level 3 lymphoma. Now, this weight loss can occur due to the body's increased energy expenditure to fight off the cancer and/or because of decreased appetite. 40% of patients with Hodgkin's lymphoma present with the classic B symptoms, meaning fever, night sweats, or unattended weight. One of the earliest and most common signs of lymphoma is painless swelling of the lymph nodes in the neck, armpits, or groin.
What about all three?
Neck is the most common site of involvement, as two-thirds of patients have enlarged cervical and or supraclavicular lymph nodes. Now, lymph nodes...
I wonder if that could be in this guy right here. Been like that for around 10, 12, 14 years since I noticed it. Gets larger and smaller from time to time.
They're usually non-tender and have a firm, rubbery consistency. Swollen lymph nodes or enlarged lymph nodes can also be caused by infections. Persistent swelling without any other signs of infection become more concerned with cancer, especially if they're not tender. Bob did not have this warning sign, which is pruritus. So itchy skin, it only occurs in 15...
Oh, there's bugs on me. There's bugs on me, but there's no bugs on me.
But if it does occur, it's usually the first clue to diagnosis.
Yeah, especially right there, too. That's an area. It seems like along the spine from the back. See, like, look at the back of his head even. See, he's got a red mark right there. But, the medulla oblongata along the spine, right down in between the shoulder blades. The fibrous, filamentary, whatever, nano strands. They seem to be concentrated around the spine and the neck and the back of the head, or the nervous system.
So before the diagnosis of Hodgkin's lymphoma was made, the itchy skin is typically
Yeah, the wrist. There was the wrist. That's why the copper took care of that on me, thankfully, and mud baths. But I still get issues, with the throbbing, pulsing wrist. It just throbs. It's probably, what do they call it? Capillary action in the lymphatic system, the lymphatic capillaries. I'm guessing that's what that is, because it's like it just pumps right there. And yeah, so anyway, on the wrists, there's Morgellons
body
Lymphoma.
tends to cause lots of scratching. This
Back of the neck.
itching results from the release of specific chemicals by the cancer cells, which causes irritation and inflammation of the skin. Sometimes there's other signs and symptoms depending on the exact location of the lymphoma and how far advanced it is. For example, sometimes lymphoma in the chest can grow so large to the point of impacting vital structures inside the chest, and this can lead to chest pain, cough, and difficulty breathing. So, what about Bob? Well, about a week after he went to the urgent care clinic, he starts feeling short of breath, and this gets worse and worse to the point that his girlfriend brings him to the ER. Now, the ER nurses recognize this guy's in trouble, as his heart rate is fast, the blood pressure is low, and his oxygen
Yeah,
levels.
that's another Morgellons thing. When I get lightheaded, and the lymphatic veins would be all swelled up, and my wrist would be throbbing at 120 beats a minute. But I feel it in my wrist, in my elbow, under my arms, in my neck, down my spine, in my groin, in my leg. Every point on my body basically feels as if my pulse needs to be racing at 120 beats per minute while I'm sitting there doing nothing. And airplanes are flying over, of course, let's not forget. Anyway, I lost my point.
Bob's girlfriend starts getting really worried, especially after the ER doctor sees his chest x-ray and tells her that there's fluid around his heart and we need to move him quickly to get him to the intensive care unit. Now, normally, a pericardial effusion by itself is not an emergency, but sometimes if this fluid around the heart develops very quickly, it can start compressing the chambers of the heart, and this is called cardiac tamponade. By the time Bob was being wheeled out of the ER, his heart was shutting down. Thankfully, we were able to stabilize him after we intubated him and put a breathing tube down, and we had him on the ventilator. And then the interventional cardiologist, he came by and drained that pericardial effusion, and that relieved the pressure on the chambers of the heart.
Fluid.
Eventually,
See, that's fluid around the heart. There's fluid in other places, though. I get swelling in my shoulders on top of them, and especially my left. It's not so bad now, but... And my mom with her lymphoma, the lymphs aren't working, it's not draining properly. She gets this buildup of fluid in her arm, and her arm would get all swollen up. And what does her doctor say to do with it? Wrap it with kinesio wrap tape so that it spreads it out to other parts of your body. So the infected toxic fluid that builds up from the non-functioning lymph glands, the doctor's answer is to spread it around under your skin while you're battling cancers of like 3 different kinds, doing chemotherapy. And why wouldn't you want to get that stuff out of you? Get it drained or do some exfoliation, like I tried to talk her into with mud or something, sauna, something, water, hydrotherapy, get it out. Oh no, it's not a big deal. She wraps it up and keeps it in there. Like, okay, whatever. That's just ridiculous. And how doctors could be telling her that you don't have to just spread it out so that it doesn't blob up in one area. Get it just push out under your skin, and if it's not leaving her body, it's not leaving her body. If it's flushed waste from the immune system, then it's probably toxic and ought not to be in your body. Was going to be flushed, but that system's not functioning. So instead of trying some other way of getting rid of it, their answer is just keep it in you. Keep it in you. You'll get over that cancer, right?
he has a lymph node biopsy done, which involves removing a small sample of tissue from the affected lymph node and then examining it underneath the microscope, and that confirmed the diagnosis of Hodgkin's lymphoma. After his treatment, he has a dramatic improvement and was able to leave the hospital. The prognosis for lymphoma, it varies depending on the type, the stage, and the patient's overall health. Generally, early detection and treatment leads to better outcomes. The survival rate for Hodgkin's lymphoma is relatively high, with a 5-year survival rate of about 90%. Non-Hodgkin's lymphoma has a more varied prognosis with a 5-year survival rate